In tough economic times, some people seem to think that public health is one of the easier budget items to cut, at least when you compare it with more visible services with their more clearly defined populations. Healthcare for All is fighting these state budget cuts. It's an organization best known for its long and successful battle to bring about mass health. Now, Healthcare for All is in a different fight, and to tell us about it is their executive director, Amy Whitcomb Slemmer. Amy, welcome.
So thank you very much. It's a pleasure to be here.
Our intro was reminding people that Healthcare for All's long and successful battle to bring about mass health, but I take it there's a lot more that you folks do.
That's exactly right. We actually have a very broadly based mission where we call on the state to figure out how to come up with a patient-centered healthcare system that is affordable, accessible, culturally competent, and available to all residents of Massachusetts.
Okay. One of our top stories in the show tonight in all the newspapers was about the shortfall in state revenues. So what kind of cuts are we facing?
They're significant this year. We do have a significant budget shortfall that will mean that there are people around Massachusetts who will not have access to programs and services upon which they depend for their health care. And in Massachusetts, we're looked to now as a national model of figuring out how to get people health insurance. We've managed to cover more than 430,000 new folks in Massachusetts have health care coverage who didn't have it before health reform. And we want to make sure that the state continues to fund those programs that are so vital in the state. And the budget is, there is a significant shortfall. We need to figure out how to raise additional revenue to be able to fund the programs upon which people depend.
I was talking about some of the things that this is seen as easier to cut because it's not quite as visible. Who are some of the groups that could really get hurt by some of these cuts?
Well, all of us are actually hurt when you cut public health, and we think the argument that now that people have health insurance, they don't actually need public health programs is absolutely wrong. And the example we have now right in front of us is the work and the programs that were needed to work and combat the swine flu. We know that there are people everywhere who are worried about making sure that they stay well and they know where outbreaks are. And without public health dollars going to the Department of Public Health, we'll be at a loss. We won't be able to track it appropriately and keep people well.
Of course, one way to deal with the smaller budget is to control cost. I take it you have some ideas on controlling cost or some.
In Massachusetts, we do, and actually the state decided strategically that we would first take on access for health reform, and we got lots of people coverage, and now health reform phase 2 is figuring out reducing costs and improving quality. And the work of the Payment Reform Commission, I think, will have a significant impact on the way we pay for healthcare services in the state. We really believe the next step is we will undo the fee-for-service model that is what's used across the country and is used in Massachusetts.
The other way to get more revenues, this is the tougher one, but it's taxes. First off, where do you want to see higher taxes? What do you think we should jack them up on a bit?
Well, tax conversations in this economic time is very difficult, but we know that we need additional revenue. And ultimately, Healthcare for All believes that we need to go examine the income tax and figure out a more equitable distribution of those revenues. But in the short term, we have endorsed a number of new revenues, including removing the exemption on alcohol and snack and sweetened beverages. Currently, our tax code treats them as though they are food, so they're exempt from taxes. We think we should remove that exemption. We also think that providing parity for non-smoke tobacco products needs to be, we need to increase the tax on other tobacco products other than cigarettes. We have increased the tax on cigarettes, and we've seen a tremendous public health benefit. People really have are not smoking at the same rate as they used to, and now they're chewing tobacco and flavored cigarettes. We think should have a similar tax structure as the one for smoking for cigarettes.
Do you get a lot of pushback on this? I mean, it would seem like the people who would care about their cigarettes or their six-pack would care rather intensely about it.
We know that this is a difficult economic environment, and we also think that there's really a double benefit in taxing tobacco products and sweetened beverages and alcoholic beverages in removing the exemption for those two. It contributes to the overall public health, reduced costs for the state at large, and raises revenue.
Now, I also understand that you have some other taxes, maybe in the area of junk food? Is that one?
That's part of the overall public health approach that Healthcare for All thinks that we need to look at for increasing revenue. Foods that don't have nutritional value, we believe, should be taxed. Currently, it's not taxed as though it was nutritional food. So we think there's room to raise some revenue there.
I can understand higher taxes on the cheesy puffs, if you want to take a trip down the junk food aisle, cheesy puffs, Twinkies. But what about folks like me who just like a little bit of frosting on their shredded wheat? Where do you draw the line?
If it's nutritious and good for you, we would want to keep it in the food category so that it's exempt from taxation.
And lastly, you folks have a helpline folks may not be aware about. Can you just tell us briefly what your helpline does?
Absolutely. We provide direct services to anyone in the Commonwealth who has questions about their health insurance, is having problems getting care that they need. They can call us at 800-272-4232. Our calls are answered in English, Spanish, and Portuguese. We have counselors ready to talk to anyone who needs help from 8 a.m. to 6:30 p.m. And we really can provide some direct help to folks who are confused or worried or need to know what health insurance programs they qualify for. And now with the federal stimulus dollars, we actually have some good news for people. There are some supplements, some subsidies that people qualify for.
Good luck on that long budget fight that you have upcoming, and thank you so much for being with us from Healthcare for All, Amy Whitcomb Slemmer.
Thank you very much, Joe. It's a pleasure.